Well, and this probably is as good a point as any to talk about treatment options, and I guess emphasis on options, plural. But what are some of the options available? And maybe if we could just start with mild sleep apnea and then take it on over to moderate and severe.
Yeah, from mild to severe, we basically have 3 classes of ways we can treat things, or 4 classes. If it's really mild and it's just the snoring is not a really big problem and there's not much sleeping, sometimes we just ask people just to elevate their trunk when they sleep. And if you get your back elevated because of the way your throat's made, the snoring and apnea is better. Also with mild apnea, sometimes we send people to a dentist, and there's an appliance. It needs to be custom made that you can wear when you sleep at night, depending on how your jaw and teeth fit. That actually kind of repositions your jaw, and it opens up that space back there that's collapsing. Also with mild to moderate apnea, a lot of times an ear, nose, throat physician will see a person. There's a whole number of different ways they can open up any narrowing that's in the nose or throat that's causing the apnea and snoring. And the thing we use most commonly, and you almost always use in severe apnea, is CPAP, which is usually a little mask that fits over your nose. And what it does is it applies extra air in your nose, and that extra air acts like an air splint, and it keeps this tissue splayed open. You quit having apnea, you quit snoring. Very extreme cases, like people we see in the hospital who are in heart failure from apnea, will actually require tracheostomy. But that's unusual, and that's something extreme we usually don't see in the sleep lab. You usually end up seeing those people in the hospital.
Right. Well, I think that's a helpful review of the different options, and so often patients don't, they may know a friend or relative who's on CPAP and they assume that that's
Right.
the only option. So